This is critical thinking on cardiovascular physiology, and let's look at the questions. The first one is on valves and has to do with the cardiac cycle. Second question is a clinical question on, again, related to cardiac cycle. This has to do with systole and diastole and hence cardiac output. Here a more direct question on cardiac output. And then the last one is on blood pressure. Now let me go back and tell you the correct answers and how you should be thinking. So this one is on asks you when the semilunar valves, which are the aortic and pulmonary valves, when they will close. And the correct answer is the third one, which is at the end of ventricular systole. Now if you look and see why this is the right answer, and let's just take the ventricles. So here are the ventricles, and from the right ventricle you have the pulmonary artery coming out, from the left ventricle you have the aorta coming out. So when the ventricles contract, they push blood into the aortic and into the pulmonary and the aortic valves. So when they contract, which is ventricular systole, these valves have to be open. Hence, obviously, at the beginning of ventricular systole, these valves will be open. They will not close. So that is not the correct answer. Now, the second choice, which is at the end of ventricular diastole, there is no point in these valves closing after the ventricles fill with blood. So let's say the blood has come from the atria into the ventricles, and now the ventricles have finished relaxing, which is the end of ventricular diastole. At this point, now the ventricles will begin to contract, so systole will start. So there's no point in these valves closing at that point, which is at the end of ventricular diastole, because they have to open really, which is when the systole begins. They will close at the end of ventricular systole, or the other way we could also say at the beginning of ventricular diastole, not at the end of ventricular diastole. So therefore this is not the right answer either. So the correct answer is when their job is done. That means when the ventricle has contracted, it's pushed its blood into these arteries, and then now it's beginning to relax, which means that contraction has ended. So that is at the end of ventricular systole is when these valves will close. Let's look at the next one is, what happens when there is severe tricuspid stenosis? Will it result in right-sided heart failure? And the correct answer is yes, true. Because again, if you look at the heart, and this is the interatrial interventricular septum, here's the tricuspid valve, the mitral valve, the pulmonary here, and the aortic. Now suppose there is stenosis of the tricuspid valve, so it is really narrowed. What will happen? Blood cannot go from the right atrium into the right ventricle. So therefore, the right atrium, which receives the superior vena cava and the inferior vena cava, what will happen? Since blood from these cannot go into the right atrium, it will actually back up into these veins. When it backs up into these veins in the superior vena cava, you will end up with engorged neck veins, because those veins cannot drain, engorged neck veins. And inferior vena cava, if the blood in the inferior vena cava is backed up, it is bringing blood from the lower part of the body, from all the organs in the abdominal cavity. So what will happen is that you will have the liver will be enlarged, because blood from the liver cannot go into the inferior vena cava, it cannot drain into that. So there is engorged liver, so the liver is enlarged, engorgement of the liver, it feels tender. The blood from the limbs, the lower limbs, cannot go up, so then you get edema in the lower limbs, or what is known as pedal edema. So all of this you can see is on the right side, so there's a problem on the right side. So yes, it will cause right-sided heart failure. So whenever there's a valvular problem on the right side, if it is tricuspid or if it is even pulmonary stenosis. So imagine if the question had said pulmonary stenosis, the same thing would happen. Blood comes into the ventricle, but it now can't go through the pulmonary valve into the pulmonary artery. So what will happen? The ventricle will first have a fill up with blood. I mean, it cannot be passed out, so the ventricle would be would not be able to empty properly, so the blood will then backtrack, which means that the atrium cannot pour all its blood out into the ventricle because it's already full, which means it'll go back in the same way. So any problem in the valves on the right side will cause right-sided heart failure. Any problem with the valves on the left side and stenosis will cause left-sided heart failure. So that's how you have to work out this question. Let's look at the next one, which says increasing the length of ventricular diastole. So systole is a more fixed time. Diastole, on the other hand, can change. So what happens if you increase the length of ventricular diastole? That means the ventricles are able to relax for a longer period of time. If they relax for a longer period of time, it will help in coronary artery filling. Why? Because the coronary arteries fill during ventricular diastole. So if the length is longer, that means they'll be able to fill better. Next one, it'll increase stroke volume. Yes, it'll do this too. And why is that? Because if the ventricles are allowed to relax for a longer time, that means they will fill better. And if they fill better, more blood will be in the ventricles, which means the end diastolic volume will increase. So the end diastolic volume will increase. So if the blood inside the ventricles is more, it's naturally going to be able to push out more blood, which means the stroke volume will increase. And actually, this is how athletes maintain their cardiac output. See, cardiac output is heart rate times stroke volume. Now, because of a high vagal tone, the heart rate in athletes is low. Now, if this is low, this has to increase. So the athletes maintain their cardiac output by having a very high stroke volume. And the reason for that is if the heart rate is low, that means the ventricles can relax for a longer time, fill with more blood. If they fill with more blood, they can push out more blood per beat, which means they can increase their stroke volume. Next one, would increasing the length of ventricular diastole increase the contractility of the ventricles? Yes, it will do this too. And why? The reason is the same. If the length is increased, more blood will fill in the ventricles and the end diastolic volume will be more. If the end diastolic volume is more, that means the ventricles will stretch a little bit more because they are filled with more blood. And remember from ANP1, if there is increased muscular stretch, the contraction is much better. So therefore, since the ventricular wall is stretched, that will improve the contractility of the ventricles. Hence, it will do this too. So therefore, the correct answer is all of the above. So it's all of the above. So that's the correct answer for this question. So you can see how you have to reason out all the choices. Now this one, which of the following will not reduce cardiac output? So let's look at the right answer, and the correct answer is the first choice. Working out for 15 minutes on the treadmill. This will not reduce cardiac output. On the other hand, it will actually increase cardiac output. So again, the reason is cardiac output is heart rate times stroke volume. So what will happen when you work out or when you exercise, your muscles are working, and when the muscles of your limbs are working, especially the lower limbs, they squeeze the veins over there, and those veins are squeezed, so they increase venous return. So when venous return increases, that means more blood goes into the atrium, so more will go into the ventricles, so end diastolic volume will increase, which means that it can increase the stroke volume. So therefore, working out or exercising helps to increase cardiac output. Why are the other choices not true? Because a person with hemopericardium means that there is blood in the pericardial cavity. So imagine if this is the heart and this is the pericardial cavity which surrounds it. If blood fills this cavity, naturally this cavity will enlarge. And what will happen? The fibrous pericardium, which encloses it on the outside up here, that is rigid. It does not allow the cavity to increase beyond a certain extent. So this will be at the extent of the heart. So this blood here will compress the heart, and therefore the heart will not be able to contract properly. If it can't contract properly, obviously it cannot maintain cardiac output, so it will reduce cardiac output. So this one will reduce cardiac output. Second one, sitting immobile for an extended period of time. Again, this has to do with venous return. So when you're sitting immobile for an extended period of time, your muscles are not working, the lower limb muscles are not working, so blood tends to pool in your limbs and the venous return is reduced. If venous return is reduced, the end diastolic volume is reduced, which means the stroke volume will be reduced, so cardiac output will reduce. In fact, this sometimes causes dizziness. So this it does reduce cardiac output. And lastly, the third one, presence of a myocardial infarct. Now, if a portion of the heart muscle is damaged, which is what happens in myocardial infarction, that means the muscle will not be able to contract properly. If it can't contract properly, naturally stroke volume is reduced. If stroke volume is reduced, cardiac output automatically gets reduced. Therefore, this also reduces the cardiac output. So these three reduce cardiac output, whereas the first one, which is different from all these, exercising helps increase cardiac output. So therefore, this would be the answer to this question. And let's look at the last one, which is blood pressure will increase in all of the following situations except, and the correct answer is vasodilation. And why is that the correct answer? Because blood pressure is peripheral resistance times cardiac output. So this is blood pressure. So anything which increases either peripheral resistance or cardiac output will cause an increase in blood pressure. Now, presence of an atheromatous plaque in the aorta will increase peripheral resistance, because imagine if this is the aorta and this is the normal size and you have a plaque up here. So now the caliber, the lumen of the aorta is narrowed, which means blood will flow through and the pressure will increase because the resistance from the aorta is increased. So this will cause an increase in peripheral resistance. So this will increase, in this case, the blood pressure will increase. So blood doping. In this situation, in blood doping, what happens is usually athletes do that, but otherwise the extra packed cell volume or extra red blood cells are pushed into the blood, which means it makes the blood more viscous. That means the blood is thicker. And it's like instead of passing water through a tube, you're passing honey through a tube. So when anything is thicker in consistency, it increases peripheral resistance. So again, blood doping increases peripheral resistance. So like the presence of atheromatous plaque, it again will increase blood pressure. So these two will increase blood pressure. Third one, injecting a patient with epinephrine. Epinephrine or adrenaline causes vasoconstriction, which means again the blood, if this is the normal size of the blood vessel now becomes vasoconstricted, it becomes narrow. Whenever it becomes narrow, peripheral resistance increases and hence blood pressure will increase. So in all of these situations, blood pressure is going to increase. Why is vasodilation not going to increase blood pressure? Is if this is the normal size of a blood vessel, in vasodilation it has dilated. So now blood will be able to flow freely. The resistance has decreased. So peripheral resistance has decreased, and as we said, blood pressure is peripheral resistance times cardiac output. If this is low, then naturally blood pressure will be low. So therefore, all these three will cause an increase and this one will not cause an increase. So therefore, this is the correct answer to this question. So I hope after listening to all of this, you're able to think for yourself and come to the right conclusion on all the choices you will get in for the questions in your quizzes and your test.